A very good morning, good afternoon, and good evening to everyone today who's attending the show. A very warm welcome from your host, Dr. Snehal Deshpande. By profession, I'm a developmental therapist and a physiotherapist primarily, and I'm a wellness coach. I also have a great passion for wellness, and I am the director of the CME, that is Continuing Medical Education Programs for Heartfulness. We also have a lot of family connect programs, and I'm the subject matter expert also for those programs for heartfulness. So, my dear friends, today we are here to with a great panel, a wonderful panel of speakers to discuss a topic which is very, very close to all of us. Everyone comes to me as a physiotherapist and says, "Pair mein dard hai, my legs are paining," and I see many people on the road walking, toddling around, just waddling around on one leg to another leg. So, yes, my dear friends, today's topic is osteoarthritis, OA knees. It's a global problem. Many of the women nowadays whom I meet, who are in maybe their mid 40s, 50s, nearing 50s or 55, say, replacement karma, should I go in for a knee replacement? So 60% of all the OA cases are knee osteoarthritis. It is the 11th highest contributor to disability. About 9.6 million years were lived with disability from OA around the world in 2017, and there's a 48% increase in the number of people affected globally with OA. So this is a very, very common joint condition. And here we are with a great panel. We have with us my colleague, my friend, Dr. Deepak Kachalia, who is a physical therapist from Mumbai. He specialized in sports injuries, manual therapy from Melbourne, Australia, conducted around 150 workshops and over 100 national and international events. He's ex physio for the Mumbai and Oman cricket teams. He's a recipient of the Special Award from the West Zone Women's Association and the Indian Association of Physiotherapists in June 2022. And he has written a book on knee injuries. He's the author of a book on knee injuries. Welcome, Dr. Deepak Kachalia. It is really awesome to have you on this show.
Thanks a lot, Snehal.
My
Thanks.
My next friend and colleague is Dr. Manish Kulkarni. He is a leading orthopedic surgeon by profession. He runs his own hospital in Pune. One is Dhanvantri Hospital, and he also is the director of Iris Healthcare. His zest of life is to provide passionate aid and service to his patients, organization, or individuals he comes across in life. Accomplished, ambitious, and dedicated, he definitely provides a lot of counseling, training, development, and instruction and consulting to all his friends and patients whom he meets. He's the Associate Director of Heartfulness CME India. He has conducted several workshops in corporate offices, hospitals, and institutes. Welcome, a very, very warm welcome to you, Dr. Manish Kulkarni.
Thank you, Dr. Snehal. Thank you.
And our third friend, you know what, when I met Dr. Anshul, I hardly knew what functional medicine was. I'd heard about integrative medicine, but Dr. Anshul Gupta practices functional medicine and integrative health and medicine. He's a board certified family medicine physician with advanced certification in functional medicine, peptide therapy, and also fellowship trained in integrative medicine. He specialized as a thyroid functional medicine doctor and helps people reverse their unresolved symptoms of thyroid dysfunction. He believes that knowledge is power and wants to educate people about a healthy lifestyle. He's a proud father of two lovely children and a lucky husband to an adorable wife. His hobbies are to travel, hike, meditate, and practice yoga. Welcome, a very, very warm welcome, Dr. Anshul Gupta. And needless to say, let's get into the show with, oh my dear. So this is what knee osteoarthritis is. You can actually see the amount of burnout our knees face. And to be very frank, the origins of knee osteoarthritis, or OA as it is known, is very common to us as Homo sapiens. Why? Because we walk bipedal. So bipedal walking has come into us, and of course it has freed our hands so that we can work better, but the entire weight of the body goes on to what we call the hip and the knees. So the origins of osteoarthritis and the history of osteoarthritis is civilizations back, but the Greeks, the Egyptians, and our ancestors could do a little about it. But that time, yes, the problem was not so bad. It was because the lifestyle of people was not really as as I can say, as we call sitting is the next smoking. So we sit a lot and we have become very lazy. So that's what is happening. Our lifestyle problems are exaggerating osteoarthritis. So my first question to Dr. Manish is, what do you mean by OA as it is commonly called? What are the symptoms of this type of arthritis, and which joints are the most affected by osteoarthritis? Dr. Manish Kulkarni, please.
Yeah, thank you, Snehal, for the question. It's a very common question that we come across. As we are aware, 4 out of 5 ladies suffer with osteoarthritis. Osteoarthritis basically is a degenerative change of any particular joint. So we have osteoarthritis of the knee joints, we have osteoarthritis of the hip joints, and any other joints also can be associated with osteoarthritis. The most commonest joint that we see undergoing osteoarthritis is the knee, followed by the hip joint. With the COVID coming up, we are seeing osteoarthritis of hip getting raised. That is what Dr. Anshul and Dr. Deepak will also agree with it. But we will restrict ourselves today for the commonest topic that we have is osteoarthritis of the knee. Basically, these patients initially complain of only pain. Okay, pain usually restricted to the medial side of the knee joint, pain more on walking, pain more on climbing steps, or pain more while the patient is sitting down in a squatting position or trying to get up from a squatting position. Still in India, we have a lot of people who use the Indian style of toilets. So these patients also come up with complaints of they find it difficult to sit in an Indian toilet style of toilet or use an Indian style of toilet. So this is the most commonest that we see in all the osteoarthritis that we see. At least 70 to 75% people suffer with osteoarthritis of the knee joint. As the disease progresses from stage 1, which is an initial pain, we have a limitation of our joint movements, and as the joint movements limit, we start getting deformities, and that causes the gaits to change. So what Dr. Snehal you mentioned about people having waddling gait, people having change of gait, is basically what we say as neglected osteoarthritis, which is going on progressing because of what we will discuss today. So I hope I have been able to answer that.
Yeah, I think you have done a great justice to this question. And what I would like to also understand is, when I see women of maybe 50, 55, and they start complaining of pain in the knees and pain in the back, and then they start putting on the, you can see that the weight distribution is more towards the pelvic and the abdominal, that is the hip area. So, Dr. Deepak, my next question to you is, why do you feel that it is the women who are more affected as compared to the men in this condition? Why is it that we see that women are more
Yeah,
affected?
the reason is very simple because there is a lot of structural change in female and male body in terms of mobility and restricted movements. Normally, ladies have a hyperflexibility in the spine compared to the males. What we call it spondylolysis is very common in ladies, which gives unstable back. And because they gave birth to the children, their spine is hypermobile and they have good mobility. The only thing after delivery, normally the concept of post-natal exercise is not very well developed in India still. So they do not work on the abdominal toning or abdominal weakness following childbirth, or even in age advances, they don't pay attention to the core stability around the waist. When the core gets weak, the biomechanics of the lower extremity changes. There's shortening of the short muscles of the hip and lot of things, other things. But that makes the knee unstable. If back is not strong, abdominal muscles are not strong, there's imbalance between back muscles and abdominal muscles, which is very common in ladies because they develop obesity at the age of around 40, 45, and lordosis is more, abdominal bulge is coming out more, putting a lot of load on the back. They may not complain of backache even with early osteoarthritis. They are the ones who are very prone to osteoarthritis because of unstable spine. I would put it this way: unstable spine, imbalance of the back muscles and abdominal muscles, causing changing biomechanics of the whole extremity that causes osteoarthritis early in them.
Thank you, Dr. Deepak. So you, as I hear you very right, that osteoarthritis is the most common joint condition, most commonly seen in females in who are 45 or over. It is related to activity, as I understood from Dr. Manish as well. It is an activity-related joint pain, and also as knees take the burnt of the whole body structure, it is the knees which suffer the most in osteoarthritis. So, as we look at obesity as one of the conditions, and as we see that women over 45 have a lot of changes, hormonal changes, which they really go through, they pass through, especially in a country like India, where women don't understand that fitness, as Dr. Deepak mentioned, that the stomach muscles or the core group muscles and the hip muscles, that is the hip extensors, very important for us as women to be taken care of, but we don't do strengthening. So, Dr. Anshul, my question to you is, what type of problems do you find in women of this age, and how does integrative health really play a role in osteoarthritis?
So thank you, Snehal, for asking this question. So what we are realizing is that anybody who has been diagnosed with osteoarthritis, they think that the only treatment available for them, as you said, is a knee replacement. Like sooner or later. What studies show is that if a person physical conditioning is not good, even after replacement, we see that their results are not good, or sometimes even their pain don't go away completely. So this integrative model of care addresses all different aspects of osteoarthritis. We're only looking at the joint aspect of it, but as Dr. Deepak pointed out, who is going to work on the strength training, who is going to work on the muscle, who is going to work on the obesity, and then who is going to work on the overall diet, right? So that's where the integrative medicine model of care definitely has an added advantage, where all different specialities work together and help improve the condition of a patient, which is osteoarthritis. Now, osteoarthritis is not just grinding out the joints and that's it. Okay, we are just not like a machine over here. We are a human being, so there is so many different aspects that needs to be handled. A lot of times clients or patients are not educated about it. Okay, what is the best diet for them? How do they reduce their weight? A lot of people with osteoarthritis have so much pain. They said, well, I have so much pain, I cannot exercise. So what are options for them that are safe for them to exercise? What diet they can eat? There are certain supplements that can also be helpful for them, along with medications that can be done. So that way, if we have different modalities of treatment available for them, including a surgeon, including a physiotherapist, including a nutritionist, or including a coach, this whole team, approach actually gives a better results for an osteoarthritis patients. As you mentioned, females, several hormonal changes happen, especially thyroid. We see a big epidemic of thyroid happening around in the country. Several females get diagnosed with thyroid. Several females have early menopause happening, and all of these things are again unaddressed. Our diet is very poor in a lot of vitamins and minerals, so bones are also weaker for a lot of females. So all those things needs to be taken into account, and then if a plan is made, then definitely the outcomes are better for those females or patients in general, as compared to just addressing the surgery or just taking medications.
Thank you, Dr. Anshul. So, my dear friends, it is known that we have to look at prevention, which is better than cure. And we also know the facts show that in the upcoming decades, the world is going to face a steep rise in the demand for knee replacement surgeries. In some of the countries, it is forecasted to have a 900% increase. So, just imagine what the magnitude of the problem is going to be. So definitely regular exercise lowers your risk of getting into this problem, but there would be some category of the people who are more prone to osteoarthritis. Now let us understand from Dr. Deepak, what are the risk factors for developing osteoarthritis? And the moment there is a little bit of knee pain, I can see so many of us saying, Abhi, I'm getting pain in the knees. I don't want to walk. I don't want to squat. I don't want to do this. I don't want to do that. And that in turn increases the weight along the waist. So, Dr. Deepak, what are the risk factors, and when do you permit a person to walk, squat, etc., etc.? Over to you.
Normally, when you see a knee patient, you all look at the foot first, whether they have flat feet or do not have flat feet. You check the knee, whether restricted movement or no. In fact, what I've seen, whenever you see a patient of knee, always check the movement first. How patella is, whether adherent or mobile, whether patient have a full flexion or full extension. Even 5-degree restricted flexion, which occurs because we do not sit on the floor even for 2 minutes. We do not squat even for once or twice in a day. The movement gets restricted. Even 5-degree restricted movement can cause early osteoarthritic changes. A 5-degree extension restriction can cause early osteoarthritic changes. Whenever a person gets osteoarthritis, before that he always gets some signal, some signs that I'm going to get some knee pain. The sign is like this. He will say, when I sit for a long time and get up, I get pain for few steps, and after few steps, pain subsides. When I try to sit in Indian toilet, I'm able to sit in the toilet, but when I get up, the pain starts. So after I start limping, I cannot sit for a longer period of time. When I go down the steps, when I go up, pain is not there. But when I start coming down, the pain starts. These are early signs that you are heading towards osteoarthritis. More disease, such signs, you should start treating the patient that try and get maximum permittable movement. And as I said, 5-degree instant movement can cause osteoarthritis. Get the full flexion, full extension, correct the flat feet if you have, wear good shoes while going out. And I would say we should stop paying those hard chappals. They do not give grip to the foot. So all patients with some signs of knee pain to start wearing good shoes, cushion shoes, some insole in the shoes if there is a flat feet. Some simple exercise, walking in the water or aquatherapy, we call it swimming, cycling without resistance is very good. In fact, I say you should not go to gym at too much of treadmill. People that do a lot of treadmill. The continuous sustained loading in one particular angle can cause early wear and tear of the joint. A lot of people feel walking is very good, very good. That was 1 hour, 1.5 hour, 5 days. That is also bad. After some time, they are going to get osteoarthritis. So anything or excess walking, excess exercising, jerky movement, you know, early trauma, early fracture, that can lead to osteoarthritis early.
So definitely the very, very important points covered. And my dear friends, facts show that 5 kgs of weight loss, which is 5% of weight loss, is equal to 90%. So it lowers down 90% of your chances of getting any knee problems in 6 years. So definitely weight is a big, big risk factor because the weight is on your knees. Understanding that.
That's a
Second
common
thing is,
factor.
I
That's a
think,
common factor. Yeah.
isn't it? And any sort of alignment issues, as he rightly mentioned, right from the foot to the back, any sort of the structural alignment having going here and there definitely puts the person at risk. So, having said this, many of the people, many women, every second woman whom I meet nowadays with knee pain want to opt for a knee replacement surgery. And so, my question to you, Dr. Manish Kulkarni, is what are the medicines you use to treat arthritis, osteoarthritis, and would you recommend surgeries? If so, what type of surgeries would you recommend for people with osteoarthritis?
A very common question with a lot of myths with it. Okay, so the commonest thing first I would like to mention, it's a nice thing to have a physiotherapist and a life coach with us because it's a combination of treatment which works in all the first and second and the third stage also till we don't land up with a knee replacement. So frankly speaking, osteoarthritis as it is divided into stages, we even divide the medical management and the surgical management according to the stages. So for the stage one, usually along with physiotherapy and along with the lifestyle changes that both Dr. Anshul and Dr. Deepak are mentioning, some oral medications are also very helpful in that. The commonest ones are glucosamine, or we have glucosamine chondroitin sulfate, or MSMs, or we have collagen peptides. Nowadays, universal is coming up. So these molecules, even they are trying with oral synovial fluid extracts. So these things do definitely have some role to play in stage one, uh, which can prolong their symptoms. These are not painkillers or steroids which help you relieve your symptoms, preserve the cartilage which is there, and see that the disease does not progress faster. Coming on to stage two, when you have an established osteoarthritis in stage two, couple of things which do definitely help is maybe an intraarticular injections with hyaluronic acid has got a good result. It gives you a good symptomatic results till at least 1.5 to 2 years documented nowadays. If you have associated degenerative changes where there is an associated meniscus tear, maybe the meniscus is not torn at the root where a root repair is necessary, we can always undergo an arthroscopic lavage of the knee joint where the knee joint is completely clean arthroscopically, followed by an intraarticular hyaluronic acid injection, maybe given 3 weeks after that. I have personally seen that the results are encouraging, the results are good for the next 2 to 3 years. Coming down to people who are in between stage 3 and stage 4 with a purely medial compartmental osteoarthritis, nowadays unicondylar knee replacements have taken a precedence where we don't do a complete knee replacement. These are people who are younger age groups who have only one joint, which is one compartment which is involved, where the uni compartment does help quite a lot, where the Synvis and all these injections have been tried, not having a sustainable result, where you can think about a unicompartmental knee replacement where the lateral compartment can be preserved and thought of some changes afterwards. The last resort, as everybody knows, is a knee replacement. Nowadays, we do start have started getting on high flex knee replacements where patients are able to fulfill their desire of squatting down. So high flex knee replacements are possible nowadays. We have a lot of modalities where they are computer assisted, they are robotic assisted surgeries. So knee replacement is the last resort. But again, I would like to reiterate that it's Dr. Anshul and Dr. Deepak's role also, along with an orthopedic surgeon like me, to see that these things do work. If you are going to come down to only to an orthopedic surgeon and going to say only medicines I want to work and I'm not going to do lifestyle changes, I'm not going to lose weight, I'm not going to do physiotherapy, they don't work. I think so. I was able to tell you in concise, Dr. Snehal, about the management for osteoarthritis as we put forward.
Excellent. Thank you, Dr. Manish. Does any of you all want to add on to Dr. Manish's answer on this when women come to us or patients come to us and say, the orthopedic surgeon has said hyaluronic acid dena hai ya reconstruction. Any of you all want to add on to his answers?
No, I think those were like, great things. Obviously, Dr. Manish, from a surgeon standpoint, made a very, very important point is that surgery is, like a very good option for a lot of folks. And ultimately, a lot of folks will end up getting surgery. But as he mentioned, if our physical conditioning is not good, then even the results of the surgery are not great. So that's a very important point that everybody should get out from here is that start working on your lifestyle right now. you know uh, Even as you said, prevention is good, but even for treatment perspective, you might be able to delay your surgery for a long time, or your chances of improving your surgical outcome would be very, very great, if you start just doing simple lifestyle changes that you can do now.
Thank you, Dr. Anshul. And that completely points to Dr. Deepak that exercising with or exercising without osteoarthritis, exercise definitely comes first. Exercise with physical activity are safe and evidence based first line management strategies in osteoarthritis, and they serve a lot of purposes. So, first question, can I exercise? Is what the patient asks. Is it appropriate for me to exercise? What is the prescription I should exercise? And how does exercise help me? Over to you, Dr. Deepak.
Yeah, the most important thing is first see the biomechanics, examine the patient properly, whether the patient is a lordosic posture, dorsal spine stiffness, shortened hip flexes, tight lateral thigh muscles, tight TA, and quadriceps wasting and patella restricted movements. If you identify it exactly, first thing I would always say work on the core. Abdominal strengthening, core stability is very, very important part, to stabilize the knee. And then time you have IT band tightness that causing some patella tracking and causing early osteoarthritis. Try and stretch IT band, which is tight and is very common. Those who are especially ladies around 60 years of old, their biomechanics is totally fired. Inner thigh muscles are weak and lateral muscles are very strong. That causes patella tracking and causes a lot of pain. Especially they cannot flex the knee. They walk with a circumduction gait. That we have got to really sincerely attend to it and try and get the patella mobility. And TA tightness is one other common factor because we do not squat, we do not sit on the in Indian combo, we do not sit on the floor. TA gets tight. When TA gets tight, you get a flat feet. You get a flat feet, your biomechanics again changes, putting a lot of load on the medial side of the knee joint. So you've got to correct the flat feet. You correct TS tight. You have to stretch TA, which is tight. Stretch IT band, which is tight. Work on the core stability. Tendon inner thigh muscles and calf to prevent the varus. What we call it, the knees bend. To prevent the virus early and to prevent the virus from getting worse, you've got to do inner thigh muscle strengthening, core stability, calf strengthening. That will help to prevent the virus getting worse. And the certain cases when the patient is not willing to go for surgery, you can encourage them to do walking in the water, cycling without resistance. Do not walk with a very bad knee. Most important, if knee is really bad, walking will not it will make it worse. So do functional exercises, your daily normal routine exercises without trying to be too adventurous with your knee. That will prevent the further degeneration and prevent the arthritis getting worse, and it will make life comfortable if you avoid certain things and do certain things.
Thank you. So you mean to say that we have to regularly exercise ourselves and regular strengthening exercises. So when many women, when I say strengthening and using weights or using a TheraBand, they shy away. They say this is not my cup of tea. I cannot do strengthening. So strengthening, my dear friends, is extremely important for your muscles. So also important
Yeah.
is the range of motion, isn't it, Dr. Deepak? You want to say something about strengthening for women?
Yeah, you can do some strengthening exercises, but you have to work under supervision. You have to identify exactly which muscles are tight, weak, and which muscles are strong. In knee osteoarthritis, vastus medialis is much more weaker than vastus lateralis. So you've got to be very selective in strengthening the inner part of the thigh rather than lateral part of the thigh. You try to strengthen the lateral part of the thigh, you have to make IT band still more tighter. And again,
Yes.
patella tracking again will cause a lot of arthritic changes. So what I've seen basically strengthen the core, anterior muscle, stretch hip flexor, tight hip flexor, you got to strengthen. It probably gets tilted anteriorly because of bad abdominal toning. So stretch hip flexors, abdominal toning, vastus medialis strengthening, calf muscle strengthening, patella mobility, correct the flat feet, and importantly keep patella mobilized, and of course quadriceps hamstring balance.
So
And then
for
you know,
people,
based on the walking in the water is the best exercise. Though we
yeah.
cannot go to physiotherapy. Physiotherapy, you can do some static exercises, simple leg raising, pressing the knee on the ground. Try and see that your knee is bending maximally. Whatever you get, try and get maximal permittable movement, even with bad arthritic cases. If movement improves, severity of pain will cut down, will be less. It not cure the arthritis, but severity of pain will be less. Your functional life might be better if you are not ready to go for surgery, or head does not permit you to go for surgery. To make your life functional, you've got to go for maximum permittable flexion, maximum permittable extension.
So as I understand and I hear Dr. Deepak, it is a range of movement in the knee, and patella is the bone which sits right onto your knee joint. It is known as
Which is
the cap
normally
of the
ignored,
knee.
which is normally
Yeah,
ignored in terms of
people
exercise
don't know that
protocol.
the patellar mobility, yeah, the cap
That
of the
that is
knee which
yes.
sits on the knee. It's
That the
extremely
tracking is commonest
important to know
problem.
that.
That the tracking is commonest problem, which prevents
Yes.
me from being functional or pain free.
So build your activity pace very slowly, practice more, and increase the level of physical activity. Also, research has shown, very important, that on the hip and knee osteoarthritis, that compared to no exercise, doing exercises significantly reduces pain more than paracetamol can reduce pain. And therefore, exercise is the medicine, what we say in osteoarthritis. Osteoarthritis can be managed successfully, but you have to be under the guidance of a physiotherapist. So seek guidance from a physiotherapist whenever you're doing exercises. My next question to you is, Dr. Anshul. When you are saying lifestyle changes, and there are a lot of diets which come into picture, and people want to follow this, people want to follow that, they want to go in for a crash diet to reduce weight. What are your views on lifestyle management and the choice of foods which come to people?
A very important question. Like I think we are in the age where every week there is a new diet release in the market, and everybody claims this diet is a new, like, treatment for everything, and this is going to solve all the problems, and all the other diets, that we have known about doesn't work. So people get very confused, because they don't know which diet to follow. So for me, the word diets itself should be changed, and we should all be kind of looking at food as a friend and not an enemy, right? So that way, like we should be eating healthy foods. So for me, the concept of food or diets or anything food plan is very simple, two prong approach. One is that food we should stay away from, and food we should be eating. So very similar approach in osteoarthritis also. Now osteoarthritis, it's a degenerative disease, but it is also an inflammatory condition, because over the course of time some inflammation do develop in our joints. So if we reduce weight and we eat an anti-inflammatory diet, those two things help people with osteoarthritis. So in that aspect, food which causes inflammation, that food is processed food. Like any kind of processed food, fried food, fast food, processed grains, like refined flours, like sugars. Those are heavy burden in our diet today. Everybody is eating. They are hidden in so many things. So always tell people, even when you're buying things, look at the ingredients. Look at the ingredients, and even breads or any other things which says made with whole wheat flour. If you look, the first ingredient still refined flour over there. So it is hinted over there. Our festivals are great, but the way we celebrate festivals is just by eating sweets, loads and loads of sugar. That's not the way, right? And the amount of fried food that we're eating is just amazing. So that's what all these food we should be staying away from, and we can easily do that with just some discipline. Few things, if you stay away from, very easily you can lose weight. The second thing is including foods which actually helps to reduce inflammation. So majority of the people of Indian origin are vegetarian, but to my horror, all these vegetarian people hate vegetables, and the amount of vegetables in their vegetarian diet is very, very minimal. So we need to eat more vegetables. If you look at where, it doesn't matter which part of the country you are in, either you will have very less amount of vegetables, and either you'll be eating your rotis or your rice. That is a major food. We need to change that. Half of your plate should be vegetables. Eat your veggies. All different colors of vegetables are important, not just one color. Colorful diet is very important. Each and every color God has given to vegetables has anti-inflammatory properties, different properties. So if you're eating 8 colors in a day of vegetables, bingo, you're doing a great job. But if you look at your diet, you might be only seeing 2 or 3 colors. That's it. So we need to eat this colorful diets. Eat all the vegetables. Half of your plate should be vegetables, whether salads, raw, cooked, steamed. We overcook our vegetables. Like we add so much oil just to make them taste good. We just dye the vegetables, so all the nutrients are lost. So just be gentle with your vegetables, eat them. Good quality protein. Again, we are lacking good quality protein. Like we used to eat a lot of, our pulses, our beans, our dals, but we are kind of refraining from eating them. So again, being a vegetarian diet, we have to make sure that we have good quality protein, which is happening, especially in females. They shy away from proteins a lot of times. So make sure you are eating good quality proteins. You don't have to become non-vegetarian or eat meat to have adequate amount of protein. That's again a myth. A lot of people have it. Even vegetarian diets have good quality proteins. You just have to focus on those things. So do that, right? So that's the diet that if you follow, just stay away from things which is not good for you and include things in your diet which is good for you, will be amazing. They're anti-inflammatory foods, which again has shown to be improvement in osteoarthritis, like our turmeric, wonderful spice, which has so many anti-inflammatory properties. Most of us do add turmeric in our diet, but some of the new cooking methods we don't add it. So make sure you're doing that. Ginger is again so much anti-inflammatory properties. Make sure you're eating or including ginger, as an important method in your cooking. So I think if you follow these simple things, that is going to help you to lose weight, reduce inflammation, and improve your osteoarthritis. The second aspect of lifestyle, obviously, as Dr. Deepak pointed out, is exercising. And again, not overdoing on one particular exercising, but understanding that you have to work on all different aspects, whether it is strength training, whether it is core training, whether it is cardio, whatever, but you have to work, and know the right exercising. And the last thing is the supplements. So there are certain supplements which can be helpful, right, along with these lifestyle changes, which can be included. So Dr. Manish already pointed out that glucosamine, and chondroitin sulfates, great supplements that we have known several research studies. very safe supplements can be used. Collagen peptides are again new form of things which have come up. A lot of people are using them as source of protein, but can also be used for improving your osteoarthritis. Then the other supplements, first of all, them is curcumin. Now, curcumin is an anti-inflammatory compound which is derived from turmeric. So turmeric is great, but turmeric has several different compounds, and the research shows that the main compound in them is curcumin. And the curcumin has several anti-inflammatory properties. There was a research study done which compared giving curcumin to patients of osteoarthritis and giving them ibuprofen. And they saw that the results of reduction in the pain was similar when people were taking curcumin and ibuprofen. So that tells us that it is a good kind of anti-inflammatory supplement that can be taken, and again very well tolerated, less amount of side effects that people can expect. So that's curcumin is one of the supplement. The second supplement is boswellia. So boswellia, again an anti-inflammatory compound which is again very easily found in India. It's come from actually Indian tree. Again, some research studies, very small studies, have shown that it can be helpful for reduction in the pain in arthritis patients. The third supplement is vitamin D. Again, I was talking about like how our bones are so weak in a lot of females. So we do see that an epidemic is ongoing where a vitamin D calcium status is very very low. So that again causes the bones to get weaker. So again, get your vitamin D levels checked. If your vitamin D levels are low, make sure you are taking vitamin D supplement on the regular basis. So again, your vitamin D levels are good. Again, no side effects of vitamin D if you're taking within the recommended dosage, and again very well tolerated. The last supplement is fish oil, omega 3s. So again, the problem in vegetarian diet a little bit is that our omega 3 levels are on the little bit on the lower side, because we do not eat good fats. Like the chia seeds, the flax seeds. Like even our Indian ghee is actually good, but obviously with a lot of diets we are recommending not eating ghee completely. So we are missing a lot of good omega 3s at times. So taking an external supplement, again, research studies do show that it can reduce inflammation and can improve again inflammatory markers in people with osteoarthritis also. So again, fish oil supplement or omega 3 supplement, again very well tolerated, not much side effects, can be taken. So those are all these supplements, can be used. But again, I think supplements are similar to medication, that they should come as the last. And the first thing definitely should be your lifestyle changes, which include your diet, which include your exercising. And then, like if you want to include certain supplements, make sure you're talking to your doctor before including any supplements, so that, there is no interaction with any medications, or they're okay with your diseases that you have.
Great, Dr. Anshul. That was so informative, and I hope our viewers are writing down every point. Or else you can contact Dr. Anshul or contact him through us at heartfulnesswellness.org. And yes, we have a lot of questions which are coming up from the audience, and we'll be putting these questions up for all the for all the panelists. So the first, is there any evidence? CS Ram asks, is there any evidence of using medicines for cartilage? That's for Dr. Manish, I think.
Yes, stage one and early stage two, some medications, as we Dr. Anshul also mentioned regarding the supplements that they have, and glucosamine and chondroitin sulfate has shown encouraging results. But yes, you have to be very specific in stage one or stage two. In advanced stage of osteoarthritis, medicines usually do not help. So medicines can be in oral formulations or even intraarticular medicines like like hyaluronic acid have shown very encouraging results. So intraarticular injections of hyaluronic acids are also very helpful in stage 2 or stage 3, but not in advanced stages. So yes, they do have their limited roles.
Do you want to add anything, Dr. Anshul?
No, I think that's great. Dr. Manish said it correctly that these in earlier stages. So that's again very important thing. I've seen a lot of folks that they have this phobia of not going to the doctors, and they wait till very late to kind of get evaluated. So I always tell them there is no harm in going there. So that you can be staged properly, and you can be diagnosed at the early stages, because as Dr. Manish pointed out, if you get diagnosed at an early stage, you can do so much. There is so much in your hand that you can improve things. Because once you go in very early stages, then there is not much that can be done. So very important. Please don't get afraid of the doctors. They are your friend. So go to them, like Dr. Manish. Get proper diagnosis so that you can take your again health in your own hands and do things to prevent from further getting it worse.
So we have few more questions, panelists. And the next question is, I'm Manisha Shah from ITS Institute of Health and Allied Science. Want to know that in osteoarthritis, which area of the joints are more risky of getting affected? Who wants to take this?
This will be again with me. I'll take it up. See, basically, an osteoarthritis of knee joint, we have got three compartments. So you have the medial compartment, the lateral compartment, and the patellofemoral compartment. The most
So you have
commonly
the inner component, the outer compartment, and the middle
and the
compartment.
middle compartment or the top, what we say. So it is the inner compartment, the medial compartment, which undergoes the osteoarthritic changes, very common. Okay, so in an osteoarthritic patient, if you are seeing around 75 to 80% have a unicompartmental, medial compartmental osteoarthritis that can get progressed to a lateral compartment. The patellofemoral is usually rare, so around 2 to 3% people only present with patellofemoral osteoarthritis. So we have all the three joints, all the three compartments getting affected. 75 to 80% is the middle compartment. We have around 20% to 25% the lateral compartment, and we have the patellofemoral compartment. In stage 3 and above, all the three are involved. So what staging we are saying is for the stage 1 and grade 1 and grade 2, where we have specific compartment changes seen. But as the stage advances, all the three compartment can be affected.
So I would just like to simplify this. We have one bone which comes from up, which is called as femur. We have two bones down, the tibia and the fibula, and we have the patella or the kneecap, which sits over all these bones. And as you can see, there are these the medial side, that is the inner side, as he said, and the lateral is the outer side, and the top of it is the kneecap. So these are the various areas which Manisha was asking. And Dr. Deepak, do you want to add on something for this answer?
Like what he says, middle compartment maximally affected. Um, and there are multiple causes for that. Why middle compartment affected more than the lateral compartment? As I said, the component cause one could be flat feet, that's the inner thigh muscle wasting. The two component putting a lot of load on the medial side because patient tends to go into virus, and that once it goes virus, we move weight on the medial side of the knee. That causes the common side is medial compartment syndrome. We call it middle compartment syndrome.
So as you can
80%
see that
almost.
the legs go
Yes,
there, yeah?
yes.
They
Bow
are
leg
like
injury.
And flat feet is one thing
that.
very, very much neglected in India. People do not give importance to bad flat feet. Early childhood they know that the person is flat footed and all this. Now, late stage also they, but they don't bother to start correction early. They don't go to a right therapist, early pediatric therapist or a pediatric surgeon and get it corrected in early stage. They are the one they
I
are
think we
prone to
completely
middle
agree with you.
compartment. Very, very
So
prone
they
to.
asked me
And
what would flat foot do? We'll put insoles and that's end of story. And I always tell
yeah,
them it's not
they
about the
must take
insoles, it's about the
very
alignment.
true. Need a proper orthotic help also along with a good physio, pediatric physio, helping the child to correct the biomechanics very early stage of life. They are the one where middle compartment is very, very common.
Early.
And one thing I would
So
like
we
to
have
add is that a lot of people go for knee surgery, like arthroscopic surgery and all this. And the moment the pain gets relieved by surgery, they neglect the knee. They feel because the doctor arthroscopic surgery, my cartilage removal pain is gone, I can do everything and do not bother to continue exercises, do not bother to maintain your knee movement, and they feel they're all about 5 years or something of surgery. Most of them end up with early knee or early arthritic changes because restricted movement, muscle imbalance, and muscle wasting. So you got to see that person going for surgery needs to be rehabilitated properly following surgery.
I think one last question we have, and before we wind up the session, Amar Singh is asking us how we improve the pain of knee when we stand from sitting position. How can we improve the
Pain
pain of?
before getting up from the, if you sit for a long period of time, before getting up from a chair, right, that is the question they get pain, I suppose. So if you are sitting for a
Yes.
long period of time and want to get up, first you do free movements of the knee, do some movement of flexion extension of the knee joint, so that once you get up, the pain is less. Other thing is when you sit for a long time, do not allow your knee to be flexed more than 90 degree. You must cut down the knee flexion for more than 90 degree, because after 90 degree of movement, the cartilage gets compressed more. The cartilage gets compressed more, wear and tear increases. So tell patient to sit less than 80 degree of knee flexion when you are sitting for a prolonged period of time. And the flexion angle of flexion should be less, 80 degree. Keep moving in between your working hours, little movements here and there. Especially a lot of people say when I come out of the car out driving again, a lot of pain, cannot walk few steps. Same thing, because they are driving, knees flex longer period of time, or they sit behind stage knees flex, they get a lot of pain. So in between the travel session, they can keep the knee movement, whatever permittable movement you have in the car. Getting out, have some knee movement, and then get up and go. They'll reduce the pain. To some extent, functionally patient might be better off.
Thank you. Thank you. There are few myths and facts which I would like to also ask you all. What is the role of running in osteoarthritis? Many people feel they should not be running. Many people walk on pebbles, walk on grass. So, Dr. Deepak, do you want to say something about this? Walking on
Uh,
pebbles,
uh,
grass, running.
I normally do not encourage walking on the treadmill. A person with osteoarthritis continue static loading in one direction, increase the arthritic changes. Number two, running I would not encourage. When patient develop early osteoarthritis, there are signs of osteoarthritis. Prolonged running can also cause fire up the knee more. But there are few people who are addicted to running. To tell them to stop running completely and say don't do they, it's a problem to treat them. So you can encourage let them have a good shoes, lot of strengthening exercises, go for maximum knee and then cut down the running, short distance running, not 30 minutes or 20 minutes or 40 minutes running. That is bad. But in general, if you ask me, it's better if you avoid running for a long period of time. But what do you like to add something on this, Dr. Manish?
No, Dr. Deepak, I absolutely agree to what you say. Running is definitely not advisable, definitely not on the treadmill. Maybe in an early stages where the patient is used to running for a longer duration, you can permit for some time, but not for a longer duration. And I have not come across a literature where it says that walking on pebble or walking on grass has any difference than walking on regular floor. But yes, running on a tar surface or running on a concrete roads is definitely not advisable because that can damage the knee joints more.
Yes.
Yes. And very, very important, my dear friends, are good shoes. Investing into good shoes is extremely, extremely important. Footwear becomes very important for all of us. It's important, needless to say. But after the age of 35, when there's a compromising musculoskeletal system, you need to have good footwear to balance it out. So, a few facts and myths and facts, let's break out. The first statement goes as osteoarthritis only affects older people. What do the panelists say? Is it a myth or a fact?
Myth,
Osteoarthritis affects only
It's a
elderly
myth.
people.
It's a myth.
myth,
Myth.
it's a myth.
Okay, yes. So it's a
Percentage
myth.
is less, but definitely younger people do get osteoarthritis. Yes.
Yes,
It is
50%
So younger
of
lower
the
people
number.
I've
youth.
seen age of 30.
And I think COVID has shown
People,
us the true
you know,
story. COVID has actually shown us the true story that the more you sit and the more your lifestyle is confined to your chair, the more your joints suffer. So the
Yes,
second statement is I need an X ray or an MRI to diagnose osteoarthritis. Is it a myth or a fact?
it's a myth. Osteoarthritis basically is a clinical diagnosis.
yes.
So you don't require an X-ray or an MRI to diagnose it. It's
Yeah.
basically a clinical this thing. I
Yeah.
think
So
so.
the
Dr.
first
Deepak and
thing,
Dr. Anshul will also agree for it.
It is
Yep,
just a
that's correct.
satisfaction to the patient. Very satisfaction of the patient that my X-ray is that. But doctors would know it's osteoarthritis and which part. But they have to satisfy them, and they will not be happy. Hey, doctor, without X-ray, how can you tell me I've got osteoarthritis? So he never be convinced. So sometimes, though we know that X-ray is not going to show anything great, it's going to come the same way. But taking X-ray and then confirm, oh, then so the patient is satisfied, then half the work is done. Of treatment becomes easy for them. For us to treat them
Yes.
is easy. They are
yes.
mentally
So
convinced that what
psychological
doctor said was
benefits
right.
are more. Yeah.
Yes, and
So
X-ray
first,
definitely helps you to find out the X-ray definitely helps
Severity.
you to find out the osteophytes and the other changes that we see along with this thing. But yes, it is necessary. I agree to what Dr. Deepak says.
So the third statement is more pain is equal to more damage. Is it myth or fact?
To be very
It's a myth
frank,
to some extent.
it's a myth. It's a
Sorry.
myth. We have seen stage 3, stage 4 coming up and patients being absolutely comfortable. X-ray picture shows stage 3, stage 4, and the patient does not has very minimum pain. And
Yes.
with minimum pain, you can see patients with with minimum changes of osteoarthritis. You can see patients with severe pain. So it's definitely a myth.
So
That is
the
actually true.
next,
There was a research study done. That's what they were looking at. Like to see if there is a correlation between the pain and the amount of arthritis they had, and they actually did not see a correlation with it. So that's where they were thinking about, okay, well, is there anything else which is ongoing except for just the degeneration? Because the classical old thinking about in people is that, okay, well, I have so much pain or I have clicking in my joints. That means, okay, my joints are not doing good, or like I have a very advanced stage of osteoarthritis. And that is not true. So pain can come from various different reasons, not just from grinding of the joints. It can come from inflammation, it can come from the pressure, it can come from the fluid buildup or poor muscles also. So pain is affected by a whole bunch of things and not just the severity of the arthritis.
And as Dr. Deepak has also said very rightly, that the pains can be aggravated because of spine things, because of flat foot. So those things also need to be ruled out, not only the knee joint.
so the next statement, my dear panelists, is osteoarthritis is wear and tear or bone on bone. Is it a myth or a fact?
Variant of your.
Is it it's wear and tear or bone on bone? Is it caused by bone rubbing on
I'll
bone?
put it this way: it starts with a wear and tear. Cartilage starts getting eroded slowly, and stage come when there's a cartilage so badly damaged that it comes bones are rubbing against each other. Extreme stage of osteoarthritis, when patient joint is almost fused. Then there's bone on bone, but that is very very extreme stage.
So
You know,
here we will see it's
How-
not a myth, it's a fact.
it's a fact. Yes. What do you say, doctor? That is what I have seen.
No, I
The cartilage
absolutely
gets
agree to
worn
what
out
you say.
completely,
I
and there's
absolutely
bone
agree to what you say.
rubbing, and patella getting adherent and rubbing against femur. That also bone to bone. When cartilage is get
Yes.
absolutely eroded and too much of tightness of patella. So you can't say totally, but it's like to some extent in
It's
some
fact to
cases.
some
Yes.
extent.
The last statement is exercise will damage my joint further.
Uh,
That's a myth.
That's that's absolutely a myth or a wrong statement completely.
But yes,
So
what
thank
type of
you.
exercises? What type of exercises is very important.
Thank you.
You must understand that exercise is not the end of the world. You must know how to exercise, when to exercise, where to exercise, how much to how much resistance to be given, how much strengthening, how much stretching, how much mobility. So a lot of factors. You cannot say. Sometimes patient gets worse. Say I went to physiotherapist and next day I was so bad. Sometimes either overdone it or too much exercise too early. So it depends about how to start, when to start, where to start. You know?
And second important thing, one set of exercises is not sufficient for all the patients. Here we have four panelists over here. The same set of exercises which may help me may not help Dr. Snehal, may not help Dr. Deepak, may help
True.
Dr. Anshul.
True.
So it is
True.
individualization also very necessary for that.
Very
Very true.
essential. I think prescription for every individual person is important, whether it is lifestyle, because each of us are very unique in our structures, in our personalities, in our professions. We are all different. So each of us has a different prescription for their own body structure, depending on the alignment, depending on the muscle strength. So, my dear friends, please
Right.
don't hesitate to speak to any of the consultants or maybe people who are next door to you, whom you know that are good doctors, good therapists. You can also write to us, and also spending some time off, taking some time off, doing your relaxation, doing your meditation. You're also very much welcome to visit Kanha. I just came back from Kanha Shantivanam, Hyderabad, and I'm really full of energy and I'm so vibrant here. I really seriously and sincerely welcome each of you who is attending this show to come and visit us at Kanha Shantivanam. Thank you. Thank you, Dr. Deepak Kachalia, Dr. Manish Kulkarni, and Dr. Anshul Gupta, and the team of Heartfulness Wellness. Heartfulness Wellness has many, many more webinars which come every month. And we would like to know what you want to know from us. Suggest topics to us for the upcoming webinars and email us at wellness@heartfulness.org. Thank you, my dear friends, and till the next show. keep waiting and keep suggesting. Thanks.
Thank you for the
Thanks a lot.
opportunity.
Thank you. Thank you.